Hello friends, welcome back to my YouTube channel, that is Dr. Pooja's Gynepedia. And I am hoping that you are getting some useful information from my videos. And thank you for appreciating my work. Please do subscribe and recommend these videos. Uh, so we are on the last topic of our contraception series, that is male contraception, which is the most neglected part of the contraception. And today we will discuss about how the sperm transports, and then what are the methods of this male contraception, and about the vasectomy, which is also called as bilateral vas ligation. Then types of vasectomy, that is NSV, instruments and procedure, advantages, complication and disadvantages. Then vas occlusion methods, in which resug reversible inhibition of sperm under guidance and vasa gel. Then preventing spermatogenesis by these hormonal and non-hormonal methods. And lastly, in non-hormonal, male pill or gossip pill we will discuss. So without wasting our time, let's start with the sperm transport. So how the sperm transport? So you can see by this image, this is a male reproductive system. In this, sperm production occur in the testes, and they go and mature and store in the epididymis part lying above the testes. And from there they move along the ductus or the vas deferens, and during their passage fluid is added from seminal vesicle and prostate glands and cowper or the bulbourethral glands, and then semen will move through the penis in the urethra. And this is how ejaculate will come. Ejaculate means the sperm plus fluid, and during intercourse the sperm will be deposited in the upper vagina, then cervix, and then uterus, and then passing on to the fallopian tube, wherein the ova will meet the sperm and fertilization will occur. So this is how the sperm will transport. So to provide the male contraception, we can stop this sperm transport at three places. Number one is, we can prevent the deposition of sperm in the female genital tract by two methods. Number one is natural methods, including abstinence and withdrawal or coitus interruptus, and second is our barrier method, including condoms. Then we can prevent the emission of the semen from the vas deferens, which are called as terminal methods or male sterilization. These include, number one is vasectomy, can be done by conventional or no scalpel or keyhole vasectomy, also called as NSV. Second is our vas occlusion methods. These are the new methods which are safe and easy. Number one are clips and valves, which are not used in humans. Second is our intravas devices, which include, number one is our elastomer plugs, can be made up of polyurethane MPU or silicone rubber MSR. Second is our shug, made up of silicone plugs with the nylon thread. Third is our resug, that is reversible inhibition of sperm under guidance and smart resug. Fourth is our Vasa gel. So, third place at which we can stop the sperm transport is by inhibiting the sperm production in the testes, or by inhibiting the spermatogenesis and maturation, which is done by hormonal method, in which testosterone can be given alone or with the progesterone or with the GnRH analogs. Second is our non-hormonal methods, in which number one is our gossip ball, which is also called as male pill. Second is our gendrusa. Third is our adjuvant patch, and fourth is our calcium channel blockers, also called as CCB. Example is nifedipine. So, discussing them separately. Number one was preventing the deposition of sperm in female genital tract, in which natural methods, abstinence and withdrawal are included, and barrier condom is included. So advantages of natural method are, these are natural method, so there is no need to spend any money, so these are non expensive. On the other hand, advantages of condoms are, these are cheap and freely available by government of India. Second is, these are easily available and easy to use and carry and dispose of. And third is, there is no side effect or contraindication of condoms, rather there are non contraceptive benefits also, which is the uh, favorite questions of the examiner. So non contraceptive benefits, number 1 is, they protect against pelvic inflammatory disease and sexually transmitted infections, example gonorrhea and chlamydia. And they also decrease the chance of ectopic pregnancy and tubal infertility. And they also decrease the transmission of HIV and HPV, human papilloma virus. Therefore, there decreases the chances of carcinoma in situ. Fifth is, there are other uses of condom also which are asked. Number 1 is, they are used during the transvaginal sonography on the probe. Second is, they can use as condom catheter in the postpartum hemorrhage. Third is, they can be used in vaginoplasty. And fourth is, during premature ejaculation. So these were the advantages. Moving on to disadvantages. For natural methods, couple must be educated and motivated, and cooperation of both partners are required. And these natural methods can be applied to the female with the regular menstrual cycle only. As these are natural methods, so there are high chances of failure of these procedures, and they doesn't protect against sexually transmitted infections also. Discussing the disadvantage of condoms, they can decrease the pleasure of intercourse, and there can be high chances of failure due to incorrect use or break off or slippage of condom during intercourse. Third is, they can cause latex allergy, contact dermatitis also. And fourth is, they are not reusable at all as female condoms. Lastly is our efficacy. Withdrawal method failure is about 22 with typical and 4 with ideal use. And abstinence, including infertility awareness based method, it is 22 and point 0.4. But with a male condom, failure rate is 18 with typical use and 2 with the ideal use. So if you want to know more about these topics, you can watch my previous videos. And moving on to the vasectomy. This is the most important part of this male contraception, which is also called as bilateral vas ligation and nasbandi in Hindi. So basically, vasectomy is a surgical procedure for the male sterilization or permanent contraception. Some points need to be remembered. Number 1 is, informed consent of the male patient is mandatory, but the partner consent is not mandatory at all. Second is counseling. So before signing the phone, we have to inform the patient about all the temporary and permanent available methods, and it must be the voluntary decision of the male in his own language. And he must be told about the events before, during, after surgery, and the side effects, complication and failure of the surgery. Then counseling about the procedure is also done. Number 1 is, it is a permanent method, and we have to break some myths after vasectomy. So myths after vasectomy are, vasectomy doesn't cause any impotency in the male. It doesn't affect the sex drive, strength and day-to-day activity of the male, and testes are not removed during those procedure. Please make it very clear, the testes are not removed at all. And vasectomy also doesn't protect from the sexually transmitted infections or HIV. Third is our eligibility criteria, that or government of India guidelines. So who can go under NSV or vasectomy is, couples must be married or ever married. Means divorced or separated males can also undergo the vasectomy procedure. Then male age must be above 22 to 60 years. Couples must have at least one child of age more than 1 year and live in. There must be no any past history of male or partner sterilization. Informed consent of the male is mandatory and he must be of sound mind. Then who can perform this vasectomy? First is our MBBS graduate with training or any surgeon can perform the vasectomy procedure. Then there are two types of vasectomy. Earlier conventional vasectomy was done in which 1 centimeter scrotal skin incision was given and stitch was done. But now no scalpel vasectomy, that is NSV, also called as keyhole vasectomy, is done. So this is the most important part. The first NSV was done by Dr. Li Shengqiang of China. So let's discuss some advantages over conventional vasectomy. So why there is need of NSV? Number one is it can be done by single needle prick anesthesia. There is no need of any incision or scalpel usage, or therefore no need of any stitches. There is decreased chances of intra-op injury, bleeding and infection, and decreased chances of post-op pain and complications. Fourth is that it is a less time consuming procedure, about 30 minutes, and it is a less invasive procedure also. Therefore, less hospital stay is required and recovery is very fast. Moving on to, there are two instruments that is required. Number one is the ring clamp. As you can see, a ring is made up here. And the second is a sharp dissecting forceps is required. Discussing the procedure, how it is done. So first we have to clean the genital area and drape and then retract the penis away from the area. Then regional anesthesia with 10 ml of 1% lignocaine in scrotal skin in midline raphe is given, as you can see in this picture. Then vas is grasped extracutaneously by the ringed clamps, and then puncture is made with the dissecting forceps, and then puncture is enlarged with the dissecting forceps, and then loop of the vas is taken out and 2 centimeter of vas is excised after silk tying the each end separately. So silk suture is used here, and then dressing of the puncture site is done without the stitch. So it is basically procedure of cutting the vas is same as the tubal ligation, as we have discussed is earlier. So this was the whole procedure. Then main question is what instructions are to be given to the male patient after the vasectomy. So for 1 day he have to wear a tight underwear and rest, and antibiotics are given. Then after 3 days he can resume the work and sexual activity if he wants to. And for 3 months additional contraceptive is used because it doesn't cause the immediate sterility. Means the stored sperms are there, or we after 3 months 2 samples of husband semen analysis is taken and they must be negative, or 30 ejaculations are required to clear all the stored sperm. So meanwhile for 3 months additional contraceptive is advised to be used. Then moving on to complication, as we have discussed the procedure. So immediate complication can be like infection, bleeding, hematoma or pain. But delayed complication, number one most important is post vasectomy syndrome. It is basically chronic pain at the site of vasectomy. Second is granuloma, and third is psychological problems can be there. Fourth is failure of vasectomy can be there, which is around 0.15 per 100 women's year. Then what are the advantages of vasectomy? Number one is you can think of routine contraceptive is not required. It is simple to do and not interfere in the intercourse, and no hospitalization is required. Less invasive and cost effective than tubal ligation. And most important, I think, is that it allows the male taking the responsibility of birth control. This is the most important point for me. Then disadvantages are very less, like failure rates and spontaneous recanalization, which is very less, and autoimmune reaction can be there. So moving on to vast occlusion method, which are new, safe, and easy to done. So intravas devices in this mechanism of action is mainly we have to inject some substance into the vas deferens, which will solidify in the 20 minutes and occlude the vas deferens. So it will prevent the emission of semen from the vas deferens. So number one is our elastomer plugs made up of polyurethane or silicone rubber. And the second is our shug, that is two silicone plugs plus nylon thread. Third is our resug, which is a reversible inhibition of sperm under guidance. In this, you can see vas is exposed and resug is injected in both the vas deferens. Then resug will coat the walls of the vas deferens and it will block the sperm movement, as you can see in this image. Then if you want to go for the reversal, then it is possible with the resug. Complete reversal can be obtained after DMSO or sodium bicarbonate is injected bilaterally, which will flush the component of resug. So second is newer one is our smart resug, in which iron and copper are added to block the sperm movement more effectively. Last is our Vasa gel, the same as Resug. In this, Vasa gel is injected into the vas deferens and it will form a gel barrier, and that will entangle the sperm in this gel barrier, and sperm will reabsorbed by the body itself. So these were our VAS occlusion methods, intravas devices. If we compare it with vasectomy, it is similar to NSV, but these are less frequent and less severe. There is less chances of infections and no spontaneous reversal, and this is higher satisfaction rate than NSV. And there can be mild pain also and granuloma formation in intravas devices. Lastly is preventing the sperm production from the testes and maturation, including the hormonal and non-hormonal methods. In hormonal method, exogenous steroid are given from outside, which will inhibit the gonadotropins, inhibiting the testosterone, inhibiting the spermatogenesis. But testosterone also maintain our libido and secondary sexual characteristics. So, due to inhibition of testosterone production, there is decreased chances of libido and decreasing the male secondary sexual characteristic maintenance also. So therefore, some amount of testosterone is added to maintain the libido and secondary sexual characteristics. So in the hormonal methods, testosterone can be given alone in the form of pills or injectables, or testosterone can be given with the progesterone. Progesterone is added to complete inhibiting the spermatogenesis. So examples of progesterone are number one, testosterone injection along with the levonorgestrel pill. But there is a side effect that it will decrease the HDL level, which will lead to high chances of coronary artery disease. So, testosterone injection can be given with a desogestrel. It will not decrease the HDL level or cause any coronary artery disease, and complete reversal is also possible with this. Third is our testosterone injection with cyproterone acetate. And fourth is our testosterone implants with Depo-Provera, which is under trial. So third is our testosterone with GnRH agonist or antagonist. As you know, hormonal are having side effects also. They will cause weight gain, acne, decreasing the HDL level, which will cause coronary artery disease or oligospermia also. Moving on to non-hormonal methods, most important question is asked about the male pill, also called as gossypol. It will cause azoospermia or oligospermia, which is a derivative of cotton seed oil. which is given in the form of 200 milligram per day for 2 months and then 60 milligram per weeks. Advantages of male pill, as you know, it is a non-hormonal, therefore no major side effects. But there are disadvantages also. It can cause permanent azoospermia, means it is irreversible, and it can cause hypokalemia, can cause hypokalemic paralysis also. Second is our Gendrusa tablet. It can inhibit the sperm to penetrate the egg or inhibit the incapacitation, which is under trials, and it is available on Indonesia only. Third is our adjuvant male patch, and fourth is our calcium channel blocker, and this must you know. So it examples is nifedipine. Basically, it blocks the calcium on the cell membrane of the sperm, which will prevent its binding to the zona pellucida of the ovum. So no fertilization will occur. So it is seen that patient on calcium channel blocker nifedipine for hypertension are becoming sterile. So from here the idea came that nifedipine can be used as a non-hormonal male contraceptive pill. So guys, this was our discussion on the male contraception, and please do recommend these videos and do give me the feedbacks, and thank you so much.